What is direct thought control via invasive BCIs? Imagine being able to control a robotic arm or communicate without speaking, just by thinking about it. That's what direct thought control through invasive brain-computer interfaces aims to do. It sounds like science fiction, but it's based on real science happening today. Invasive brain-computer interfaces involve surgically implanting tiny electrodes directly into the brain tissue or placing them on its surface. These electrodes are small, about the size of a grain of rice, and are designed to sit close to neurons. Because they are in direct contact with brain cells, they can pick up electrical signals with high accuracy. This is different from non-invasive methods that use sensors on the scalp, which are less precise because signals have to pass through the skull and skin. The brain produces electrical signals when neurons fire. These signals are linked to thoughts, intentions, or movements. Invasive BCIs detect these signals from specific areas of the brain involved in motor control or speech. Once captured, the signals go through a series of steps. They are cleaned up, analyzed, and classified to understand what the brain is trying to communicate. The processed signals are then translated into commands that control external devices like robotic limbs, computer cursors, or speech synthesizers. One of the biggest advantages of invasive BCIs is the quality of signals they record. Because the electrodes are implanted directly into the brain, they can detect subtle neural patterns that non-invasive methods might miss. This allows for more precise control, such as moving a robotic hand with fine motor skills or decoding attempted speech into text. This high level of accuracy makes invasive BCIs especially useful for people with severe paralysis or neurological conditions. However, surgery is required to implant these electrodes, which carries risks like infection, inflammation, or damage to brain tissue. Despite these challenges, invasive BCIs have been successfully used in clinical settings. They help restore communication for patients with conditions like amyotrophic lateral sclerosis or after strokes that impair movement. People use invasive BCIs to control prosthetic limbs or exoskeletons just by thinking about the movement. They can also decode speech attempts directly from brain signals, helping those who cannot speak to communicate. Additionally, users can operate computer cursors or type messages, making daily tasks easier. Because of the high fidelity of signals, these interfaces offer more natural and responsive control compared to non-invasive options. In essence, direct thought control via invasive brain-computer interfaces creates a direct link between the brain and technology. It turns neural intentions into real-world actions without muscle movement. This technology is advancing quickly and holds promise for improving lives by restoring functions lost due to neurological injuries or diseases.